Now we will discuss the closed angle secondary glaucomas related to the iris. As in the previous lectures we discussed the open angle secondary glaucomas related to the iris. Okay. Now the closed angle secondary glaucomas caused by the iris related problems. The first one we have the seclusion pupillae. What is seclusion pupillae? When there is the inflammation of the iris, okay, and when this inflammation is chronic or prolonged, what will happen? The iris, there will be the adhesion between the iris and the lens. Okay, there will be the adhesion between the iris and the lens. All over the 360 degree of the pupil, okay, there will be the adhesion. And this adhesion will block the pupil, okay, it will block the pupillary outlet. So this adhesion between the iris and the lens, this is called posterior synechia. And this posterior synechia, this occlusio pattern is called seclusion pupillae. Seclusion pupillae is the attachment, is the 360 degree attachment of the iris to the underlying lens. Okay, so what will happen? It will cause the pupillary outlet to be blocked. So when it blocks the pupillary outlet, the aqueous humor will accumulate in this posterior chamber. Okay, the aqueous humor accumulate in this posterior chamber, and if you guys know from the primary angle closure glaucoma, it will push the iris to the interior chamber angle and will cause the iris bombay, and ultimately the iris bombay will cause the closure of the interior chamber angle and will cause the IUP to be elevated. Okay, so this is the pattern which is similar to the primary angle closure glaucoma, okay, caused by the posterior 360 degree posterior synechia formation, okay, due to the chronic inflammation or when the inflammation is prolonged. Okay, this is called seclusion pupillae, and which cause closed angle secondary glaucoma. Now we have the occlusio pupillae. What is the occlusio pupillae? The pattern of glaucoma is similar to the seclusion pupillae, but there is a different problem. The problem is that when there is the chronic inflammation of this iris, again there will be the formation of occlusio membrane over the pupil. Okay, there will be the formation of a membrane across the pupil. Due to the chronic inflammation or prolonged inflammation, there will be an inflammatory membrane which is called which will again occlude the pupillary outlet, called occlusio pupillae. Okay, and again this will cause the accumulation of aqueous humor in the posterior chamber and ultimately the iris bombay, which will block the interior chamber angle and will elevate the IUP. So we have the seclusion pupillae, in which there is the posterior synechia which block the pupil, and we have the occlusio pupillae, in which there is the inflammatory membrane across the pupil which will block the pupillary outlet and will induce the glaucoma in the same pattern as in the primary angle closure glaucoma. Okay, so these both cases cause closed angle secondary glaucomas related to the iris. Now we have trabecular meshwork scarring. Okay, the third one, closed angle secondary glaucoma, is the trabecular meshwork scarring. What is happening in the trabecular meshwork? We know that when there is the inflammation, okay, when there is the chronic inflammation or when the inflammation prolonged of the iris, it can cause the inflammation of the trabecular meshwork. And this trabecular meshwork, when it is inflamed, what will happen? This inflamed membrane can ultimately, there can be scarring, and the scarring can close the interior chamber angle and ultimately will cause the closed angle secondary glaucoma. Okay, so this can also cause closed angle secondary glaucoma related to the iris. Now we have the last one of the closed angle secondary glaucoma related to the iris is the neovascular glaucoma. Neovascular glaucoma, it is the elevation of IOP due to the formation of new vascular membrane in front of the trabecular meshwork. Okay, what is happening in this case? There will be the formation of fibrovascular membrane in front of the trabecular meshwork. Okay, fibrovascular membrane will form in front of the trabecular meshwork and will occlude the trabecular meshwork, okay, which will elevate the intraocular pressure and hence will cause glaucoma, okay. So what is the etiology? Why there is the formation of new vascular membranes? This is because of multiple etiologies, and remember, most of the etiologies of the new vascular glaucoma, these are related to the retina, okay. For example, the most common etiological factor for neovascular glaucoma is the central retinal vein occlusion. Okay, we know that we have the central retinal vein, okay, and this central retinal vein occlusion can induce the new vascular membranes in the posterior chamber as well as in the anterior chamber, okay. This is followed by diabetic retinopathy, okay, and we can have the new vascular membranes due to the branch retinal vein occlusion, okay. The branch retinal vein can be occluded. The branch retinal vein can be occluded, which can also induce the new vascular membranes. We can have the ocular ischemic syndrome, okay, and we can have Eales disease and tumors. These different etiologies mostly they are related to the ischemia of the retina, except the tumors, okay. Tumors by itself induces new vascular membranes. So most of these conditions are related to ischemia of retina, and hence these etiological factors will induce new vascular membranes inside the eyeball, okay. So what is the pathogenesis? Why this ischemic condition induce new vascular membranes? Why there is the formation of new vessels? This is because when there is the ischemia, what will happen? The retina in response will release a growth factor which is called vascular endothelial growth factors. Okay, the retina is releasing these growth factors in order to induce new vessels and in order to re-establish the vascular supply, okay, and to terminate the ischemia. For the termination of the ischemia and for the formation of new vessels, okay, these growth factors are released by the retina, which will induce new vascular membranes and new vessels in the posterior chamber as well as in the anterior chamber, okay. So this is the pathogenesis of new vascular glaucoma. How the patient will present to us? What are the clinical features? The clinical features are that we will have increased intraocular pressure, okay, increased intraocular pressure, but it will be a painful glaucoma. Intraocular pressure, we will have painful glaucoma plus we will have new vessels, okay. There will be the new vessels on the iris, on the margins of the pupil we will have, and there will be new vessels in front of the trabecular meshwork, okay. So these are the clinical features. Now how can we diagnose the condition? The condition can be diagnosed with gonioscopy. The analyzing of the interior chamber angle with gonio lens is called gonioscopy, okay. So when we do gonioscopy, we can tell whether there is new vessels or not, okay. Now how can we treat the condition? As the condition is dangerous, so how can we treat the conditions? Remember, first of all, moving to the treatment, you guys should remember one thing, that the neovascular glaucoma, first of all, neovascular glaucoma is an open angle secondary glaucoma, okay. It will only comes in front of the trabecular meshwork and will elevate the intraocular pressure. So the angle is not closed yet, okay. The angle is not closed. Only there is the new vessel in front of the trabecular meshwork. But ultimately, these new vessels, they will contract. these new vascular membranes, they will contract and they will close up the angle. Okay, so ultimately they will contract, these vessels will contract and they will close the angle and will cause closed angle secondary glaucoma. Okay, so first of all, the neovascular glaucoma is an open angle secondary glaucoma. But later these vascular membranes will contract and will close the angle, which will cause closed angle secondary glaucoma. Okay. Now comes to the treatment. The treatment, first we will give anti-glaucoma therapy, such as for example we can give carbonic anhydrase inhibitors, beta blockers, okay, and atropine. Atropine is important. Why? Because atropine will dilate the pupil, okay, it will dilate the pupil, and plus we know that these new vessels, they are leaky, they will leak inflammatory cells and proteins and can further block the trabecular meshwork and can enhance the intraocular pressure. So atropine will dilate the pupil called mydriasis, plus it will inhibit, it will decrease the permeability of these new vessels. Okay. Now steroids can also help. As these new vessels are leaky, so steroids will inhibit the permeability, it will decrease the permeability and will inhibit the inflammation caused by these leaky vessels. Okay, we can give and we should give anti-VEGF, anti-vascular endothelial growth factors, as the problem is because of, the main problem is basically due to the vascular endothelial growth factors, okay, which are inducing these new vessels in the posterior chamber as well as in the anterior chamber. So anti-VEGF are helpful. Ultimately, if now the vessel, the new vascular membranes are so much, so what will we do? We can do PRP, pan retinal photocoagulation. We will apply the laser all over the retina. We will apply the laser in order to reduce the ischemia and hence vascular endothelial growth factor release. Okay, so we can give laser treatment to the retina. Okay, now if still the condition is not managed, what will we do? Ultimately, in every case, we have to do surgery. For example, penetration surgeries such as trabeculectomy and deep sclerotomy. In trabeculectomy, we are connecting the interior chamber to the subconjunctival or subtenal space, and in deep sclerotomy, we are breaking the trabecular meshwork and directly connecting this interior chamber to the Schlemm canal. Okay, we are directly connecting the interior chamber to the Schlemm canal. Now, ultimately, if these filtration surgeries fail, then we induce, we keep artificial drainage devices in the sclera, okay, which will drain this interior chamber and can reduce intraocular pressure. Okay, so this was about some of the important treatment for neovascular glaucoma. I also have prepared notes. I will give you the link in the description. You can go through the notes and can learn more. Thanks for watching the video.